2 weeks from today, 2 weeks from right now, this minute, will be 2 hours and 14 minutes into the 9th annual 800 CHAB Family First Radiothon. Our goal to raise $750,000 to equip our new hospital with new equipment. And joining us to talk about that and more is, a gal who's been around for a little while here in the Five Hills Health Region. She's been a nurse for 39 years. She now serves as our Vice President of Clinical Services in the Five Hills Health Region. Laurie Albinet, thank you so much for joining us this morning. We appreciate it.
Good morning, Rob. Thank you for having me here today. It's just awesome to talk about our new hospital.
Our Family First Radiothon, 9th annual already. We were just talking about how time flies, how long I've been at the radio station, and how long you've been nursing. And we're going, we're not that old. But 9 years we've been doing the radiothon and really having a lot of fun with it.
Absolutely. It's a lot of fun. I mean, you've seen it change from the first time. It was amazing. We were also nervous about how do we do this? How do we interview? How do we get all the people to interview on it? How do we be part of everything that you're doing and the foundation is doing? But just year after year, there's more excitement, and it's been growing. It is a great thing for our community and for our health region.
It's a wonderful event. Our goal this year to raise $750,000 to equip each and every one of our 72 inpatient rooms with the latest and greatest equipment. So it's a new hospital. We want new equipment for our patients here in the Five Hills Health Region. We talked to 39 years you've been a nurse. Let's talk about, I'd like to know just how technology has changed over the years. Unbelievable, I bet, hey?
When you told me we were going to talk about it, I had to think back. I thought, wow. So when I started nursing, it makes me think about, you can think about all the x-ray machines, the flat x-rays, to CTs, to MRI, and how far we've come and how much less invasive all the diagnostics can be with your CAT scans and your MRIs. But then I go back to my personal career in nursing, and I think about the glass thermometers with mercury in them, the blood pressure apparatuses that we use full of mercury. And it was all manual. Now you go in for a temperature and stick a little probe in an ear, and you instantly got a temperature. The blood pressure is all automated. All your vital signs monitors equipment is automated. And we will have vital signs monitors in every room. They'll be standardized. They'll be the same. So no matter what type of patient you're looking at after in any room, who comes in and the healthcare professionals, you've got the same piece of equipment, and it's electronic, it's automated. It is just, it's really advanced.
Well, technology has certainly advanced and changed over the years. So has the way we approach healthcare and the way we approach families and friends who need to come and visit. It's not just visitation anymore. Families actually play an active role when someone in the family is sick. And this is the way we've designed our new hospital. Our 72 inpatient private treatment rooms at the new hospital for patients who require longer-term stays will all be standard and flexible to adapt to any condition, and all be equipped with the same stuff, including hydraulic patient lifts, vital signs monitors, and sleeper chairs for family members who might need a nap while they're staying with their loved one.
Yeah, absolutely. Years ago, we'd have family come in just for very short periods, and they would just stand on the outside, and we would tell everybody how to do things, when to do it, and no options. Really, it was just do what you're told type of thing, because we're the professionals, we know the best. Absolutely, healthcare has changed so much, and it is so important to involve the patient and the family in everything we do. They are a huge part of the care delivery, but as well as the recovery of the patient. And to be able to have, in our new rooms, we have basically, we've zoned them. They're called a provider zone, a patient zone, and a family zone. So the provider zone would be closest to the door going in. You'd have all the equipment you need and to look after the patient, and you can work on that side. The patient obviously is in the bed or the chair beside the bed. And on the opposite side, you have the family zone where the sleeper chairs are. They can be there any length of time. There's no limitations to when they can be there, because they're such an important part of the patient care and their patient recoveries.
I remember 8 o'clock at night. That was it. They ran everybody out of the hospital. You can't visit anymore. You got to go home.
Big announcement over the intercom, really time to go.
Uh-huh.
Yes. Yeah.
Yeah, those days are gone. And soon the days will be gone when we visit the Moose Jaw Union Hospital. You're in a big transition period here. Heavy pressure, I know, on everybody in the Five Hills Health region, but you're smiling. It must be going pretty smoothly.
It's going quite well. You know, you have hiccups along the way, but the excitement is growing and growing and growing. There was conversation just this week about how will we say goodbye to our old hospital. And I think we have to be very intentional about that. We have to think about that. You know, many of us have put our heart and soul into looking after patients. That was our careers. That's what we wanted to do. That's where we wanted to be. And the hospital's been around for a long time. So I'm sure it'll be really important to say goodbye to that in a bit of a formal way, probably a really fun way. But that's going to be really important to us. But move to that new hospital. It's beautiful, but it also allows us to look after patients in such a better way. A lot more decentralized care areas. So when I say that, I say instead of one big nursing station where all the healthcare providers come, we have decentralized nursing stations throughout, close to the patient's rooms. We can know what's going on, see what's going on.
Wonderful. And you've been through this before. You worked at the Old Providence Hospital, right, for a short time?
Did. Yeah, only for a year. My first year after I graduated from nursing. Things have changed, but definitely for the better.
For sure. Well, we're looking forward to trying to raise $750,000 for all that new gear, for all those new rooms, 72 inpatient private rooms. It's going to cost about $10,000 a room. So right there, that's $720,000 to equip those rooms. And we want to raise a little more for some diagnostic equipment and surgical equipment as well. So our goal at the 9th annual 800 CHAB Family First Radiothon for the Moose Jaw Health Foundation is $750,000, and we're hoping you can help us out. It's May 7th and 8th, Center Court, Town and Country Mall. Laurie Albinet, Vice President, Clinical Services, Five Hills Health Region. Anything else you'd like to add today?
No, I just say thank you again so much for all you do for us and the community. I know the community is really behind us. Are there a few anxieties, a few questions around our new hospital yet? Absolutely. But when we get there, we'll really be able to show what we've been working so hard on for a number of years now. And it is so exciting.
May 7th and 8th, Family First Radiothon, 36 hours straight. You can stay up with us, can't you? You're a nurse. You're used to that.
A little while since I've done the night shift, but for sure I've done my share. And definitely I'll be in and out. I'm not sure that I'll spend the night with you.
Thank you so much for being here, Laurie. Always a pleasure to see you, and we will see you at the Radiothon.
Absolutely.
I'll give a little bit.